are not beautiful. The obstacle that human beings. That's the problem we have in the country. The people who are actually working together are the ones who are looking for what is needed for the disadvantage of the country. And that's why they are taking us, the committee was set up in 2017. We just finally, only this November, about 3 days ago, I mean 2 weeks ago, getting the same government to sign the memorandum of understanding to say that when vaccines start producing the vaccines that the Nigerian government will buy, we needed to struggle to get that one because we know the PDP changes to APC tomorrow or APC changes to PDP. All those things we talk about, there's not no documentation. So, of course, our colleagues in Parliament, you see, we never said, and that will be the end. So, no party is going to join you until they have that kind of documentation. Good news I'm going to say. You just know this, I'm sure it is about something. The first poll of asking to be locally manufactured by Kingdom Bauer from years ago, consulted with Bauer, showing the current position of the Bauer. New disabilities each one examining pediatric birth, which contains a literal tetanus specificity, the modular and body, and they include about 4 million doses annually. The hope for that is that Africa will come together as Africa and buy from this company. And not again look for where to turn our foreign exchange and go and buy from Szabo when they are producing $1. And the Senegalese that are producing the yellow fever can go buy from them, from Senegal. Those are the diseases that will give us hope. But the way we behave right now, I tell you, the hope is not there. So doing vaccine is a huge investment. And it involves vaccine discovery, development, and all those clinical trials, all the admission all that one. And the most studies they don't cost anything between $14 million to $25 million. When you consider depending on what they increase transition, we are talking about 5.4 billion to 9 billion. And then can be as some giving you depending on how that give your phase 1 trial. You know what Syria is offering us? Our own Syria. They announced it and everybody put on the video. For 10 days they are hearing India is supporting the global. India is supporting global. What did they offer? They only have 500 million, which is $110,000. Compare that one to 14 million to do phase 1. Sometimes we make so much noise about nothing. And say, oh yeah, they are leading. And then we ourselves, those of us who are also sitting down listening to this, we are not true to ourselves. We are not courageous enough to tell our people that this is not the right thing. This is the way to go. So all of us will clap our hands 10 times. When the SCG is $110,000 to do vaccine production, when the world costs $14 million, we will not talk. Many of us will not talk. We clap our hands, we jump up, and we start praising the government for doing after everything. See what the NDCS is doing. The data they give to us is not complete. And Lagos State, you yourself, you talk about that. How many of the lab results that we got from Lagos State are tested? How many they tested? How many were positive? What did we collected this on? What did we give out this? So when you tell me 60 are positive, we always samples collected. But they collected tools. Paying attention to Jesus. Anybody that won't do that has no hope for achievement. So what is required, and what I said, what CNN has done is putting the house before the cat. And this is the cat before the house. What is the putting the cat before the house. And that is the reason why even if we have these are the things that we have to hope in the country. Because, sorry to use the word, hopeless. And unless you and I change, you need to tell the truth, to protect the truth as it is. Let me give you one final example for I'm sure that question will be really massive because I have no knowledge. But let me tell you one of the things. Right now, what is happening in Nigeria about vaccine, access to vaccine. The Vice President is talking to Pfizer. Russia came and talked to the minister. And we set up different committees for this one. I'm sure when we get our account, we look for a businessman to go and talk. And then we set up another committee there. Instead of Nigeria coming up with just one committee that takes the information from all of this one together. How many people will advise are going to do that? They are too afraid. I'm too afraid to tell the government to do what is right. Rather than that, we're facing our government for doing the wrong thing. Then again, we'll go here to punish. So, my friend, if there's no hope, the first thing about hope is that we must be ready to tell the
And we have several public briefings, as you hear as well. This is very much about sharing information and making sure that global companies who maybe are only seeing or primarily seeing the impact of the pandemic in their core markets also can integrate into what is happening with the pandemic and from government and society activists and from around the world, because that global picture continues to be so important. I wanted to point here, and think especially that it's useful, that some of the solutions here, particularly, for example, the 3D printing that we have, I think an example of how when you can work with the private sector and form a partnership, we can solve many different challenges, public and private challenges. We convened, as you see on this left-hand example, we brought together as many of the different 3D printing manufacturers as we had in our network. It was truly the entire industry. We also connected them with hospitals or academics and experts and other companies that were needed, for example, packaging companies, healthcare companies. And we were solving two challenges. First, the private sector had a challenge in the sense that many of these companies were not able to continue producing the goods that they were previously making. For example, desktop supplies or other goods that either weren't needed or were stopped to be produced during the early months of the pandemic. So they faced a business challenge of how to continue operations and how their staff, their employees could continue to work. And there are also other challenges, as we all know, continues to have one, that there was a lack of PPE. And it is quite difficult to get PPE into local communities. And so what we were able to do with this partnership was solve both challenges. First, the challenges for the business who wanted to have something new to produce, but they didn't necessarily know what that would be or how to do it, and made many of the designs for the different PPE items open source. They were freely available, and then we helped connect these manufacturers with local hospitals or different communities around the world, so that then the public challenge of PPE availability could be met on a local scale. So I think this is one creative way to think of as you consider other public-private partnerships, but it's not always directly, for example, asking the private sector for the financial contribution. It could be expertise or manufacturing capabilities or others who clearly make and how they're at. I would also then want to share with you another example when, again, Dr. Okulaja was pointing to some of the lessons of how the private sector wants to help, and then we often just need to make those actions. I think maybe many of you have heard about the partnership, the evidence-based response to COVID-19, and it's collecting bi-weekly reports and surveys to help inform different policy measures on public health and social measures. And this partnership was formed as a forum, and really what we helped to do was make that initial connection between business partners like Ipsos or Nagoya, and then public sector partners and academics and NGOs. And so I think that this partnership is a perfect example of when there can be a connection like that made, and when there are very clear asks for all the parties involved. Everyone knows what their area is and be connected. You can have quite an effective partnership. So with that, I would leave you with these final examples to also again reiterate that the most important way of engaging the private sector in the case of the pandemic, and I think in global health security and biosecurity more broadly, that it's seen that each different partnership can use a different type of resource or expertise from the private sector. In all of the examples here, it's very different what the private sector is contributing. In 3D printing, they're of course contributing manufacturing capacity. In our work with social entrepreneurs, they're often providing expertise or local support, mentorship, and others. In the partnership for evidence-based response, And I would suggest that as we think of this on a full scale, also be looked at on a local scale in terms of when working with the private sector in a country context or in a local context, that the leaders to be able to contribute many different diverse capabilities. Finally, I would like to share, because I know many of the other presentations, especially tomorrow, will focus on global health security and biosecurity questions more broadly. And I wanted to share that before the COVID-19 pandemic, the forum, and we continue to take global health security and biosecurity very seriously. And working with the private sector is very much at the core of that. So I would especially urge policymakers here today to consider that any robust biosecurity solutions and partnerships really need to have the private sector involved, especially as we see changes and emerging technologies like synthetic biology, for example, or others that are really being conducted and led by the private sector. That now when we think about the risks associated with global security, that involving the private sector in the solution is truly essential. And I wanted to share that the Academic Readiness Accelerator and our work to strengthen public-private cooperation, I think, present 5 different areas that could be built upon for future global health security partnership. We were working before the pandemic with 5 here. The first was around travel and tourism. The second around supply chain and logistics. Thirdly, around legal and regulatory questions. Fourthly, around communication. And lastly, around data innovations. And I believe that all of these areas, of course, will look quite different. They look very different now in terms of the partnerships that have emerged over the course of this year and beyond. After the COVID-19 pandemic will be behind us, I think that these 5 areas will still be very key, important ones to focus on. And we've seen, I think, emerging partnerships, for example, the African Pathogen Genomics Initiative, that I think is looking specifically at some of those areas. It's looking especially at what kind of data innovations can be achieved through partnerships and what kind of frameworks can be built to support that, and as well communicating across a continent-wide network. And so when other speakers were mentioning these, let's not wait, right? I think the key of what we have here is the attention of the private sector investing in global security, and in doing that in partnership with the I've been coming to a question about the COVID action platform for the forum's previous priorities in global health security, which will continue to be where we focus. But would like to, of course, do with our strong message that at the core of the forum is really a belief that some of the most difficult global challenges, which of course include pandemics and global health security, that some of those most important challenges really can only be solved when the public and private sectors work together in partnership with NGOs and civil society and other groups. And I would especially urge in the realm of biosecurity going forward that the private sector consider key partnership actors and get involved from the outset, like so many of the other speakers mentioned. With that, I'll thank you again and turn my back over to the moderator.
natural profile of the pandemic. It typically comes with the first wave, and if you do nothing about it, it will subside as it takes out the numbers of people that are susceptible to the infection. And then as it hunts around in the community, it will find those that haven't been exposed and are naive, and it will start a second wave and a third wave, and sometimes it goes on into fourth and fifth waves until eventually the entire community has developed a herd immunity. In other words, the community is no longer susceptible to a new infection. In the modern era, we tend to acquire this herd immunity through a combination of exposure to the virus and vaccination. But with new pathogens, we typically don't have a vaccination, nor do we have a treatment. So what is the method of intervention? So this is the typical profile of a pandemic: first wave, second wave, third wave. And if you respond late, you are going to go through the full spectrum of the outbreak, plus you will have second and third waves. Now, if you respond sort of in an intermediate time frame, you may reduce the magnitude of your outbreak and you may eliminate your second and your third wave. But if you respond early, like that, then you will significantly reduce the amplitude of your outbreak and you will flatten the opportunities for a second or a third wave. So that's the importance of early intervention and early response. So, if we look at that intervention strategy, the trigger is right there on the left. The intervention is early. You only have the green profile instead of the orange profile. And that difference between the green profile and the orange profile could represent thousands, if not millions, of deaths and avert a collapse of your economy. So, what are the government interventions? First of all, we need political insight. The government has to appreciate the trends that I've just spoken about, and it also has to have the will to act. It needs to have a strategic preparation and the capacity to predict and respond, recover, and learn from that experience. So that strategic preparation is comprised of training your health personnel to manage pathogens of high consequence, acquiring the right infrastructure in terms of laboratory and isolation facilities, ability to review your policies and your governance structures, laws, policies, and guidelines, public education, develop your research capability, and develop the ability to institute clinical trials. So, if you're able to do this, now, this is the spectrum of peace and war when we talk about biosecurity. So you have two peaks there. The first peak was a previous outbreak. It could be anything. In this case, for us, it was Ebola, followed by flu, followed by cholera, followed by Lassa fever. But we had a relative period of peace in between these two peaks. What you do in that peacetime actually determines how you're going to respond to the next biological threat. So what you do is classify there, as I described earlier on. You make sure that you've learned from the first experience and that you are listening to what the WHO and other global treaties are talking about, and that you're following the trends. And while you have the opportunity, you build capacity. And that is exactly what Lagos did and gave us the opportunity to respond quickly during what we call a war response. So, when we have a pathogen of high consequence, and we describe a pathogen of high consequence as something that is either known or unknown, there is no treatment for it, it has a relatively high ability to cause sickness and death, and there is no vaccination, and its propensity is to cause public health crisis and economic collapse, followed by chaos and sometimes security breaches. So it is very important that when you're dealing with a new pathogen, that you're able to to mount a very strong research capability. First of all, you need to be able to identify the pathogen. If the pathogen is new, you've never seen it before, you need some very advanced laboratory capacity to be able to use sequencing data to identify a new pathogen. You need to be able to diagnose it on a large scale accurately. You need to be able to store your samples and your data and develop intellectual property rights, patenting, and copyright laws, because the whole world now is evolving around the bioeconomy. And if you're not able to protect your biological sovereignty, it will be taken away from you. At the same time, while you're protecting your biological sovereignty, like we're practicing in here, develop or collaborate to develop new vaccines and drugs. And that takes us back to the C point, where we need to collaborate with international partners who have the capacity to develop vaccines and drugs, since we have a relatively weak research base and innovation pipeline structure. So it's important that we are able to collaborate in that regard. At the same time, we need to be able to roll out clinical trials, because the developed world will be producing these new drugs that we should be collaborating with them. They'll be producing vaccines, and we need, a clinical trial is a very complicated thing. It's not something that you just hand out pills and say, okay, who did well and who didn't do well. It's a very scientific, very specific, and very precise way, and we don't have much experience in terms of carrying out clinical trials. And then, at the end of that, as you can see on CNN and BBC, everybody is now preparing to roll out a vaccine strategy across the world. So these are the interventions that I've just talked about on this graph. If you respond early, you will flatten the graph. If you have no response, you will bear the full brunt of the outbreak. And the difference between the two can be a mind-boggling figure in terms of deaths averted and economic wastage. So this is the kind of profile that we need, based on our past experience, to be able to respond very quickly to an outbreak. Now, this is the Ebola experience, and this is real data. In Sierra Leone, Guinea, and Liberia, if you look at each color is a different country. Red is Liberia, blue is Guinea. We have representatives from Guinea, they can bear me witness. Green is Sierra Leone. You can see that all the clinical trials happened at the end of the outbreak, on the downstroke. Whereas we should have had clinical trials happening on the upstroke, which would have averted deaths and perhaps saved the country from an economic crisis that they have yet to recover from 5 years down the line. So this is not the way to do it. This is actually too late. So what did we do in Lagos? This is our biosecurity roadmap. From the moment we had experienced Ebola, we knew that Lagos was not in a position to withstand a surge of thousands of people becoming sick with a disease that we can't treat. We knew our health systems were weak, so we developed a biosecurity roadmap which was just about completed when Corona hit us. And the whole idea was to stop it in its tracks before it infiltrated our community, and that was what we tried to do. These are some of the things we did in developing the biosecurity roadmap. That's our very elaborate BSL-2, BSL-3 biobank at the IDH. Very sophisticated. It's the only one of its kind in Nigeria and across West Africa. The staff that work in here are highly trained. They've been trained. They've been trained for the past 5 years, a very, very strenuous training program. They are experts in molecular biology and diagnostics, and this became the nerve center of the COVID-19 response. If you go to IDH today, it's almost like a whole town on its own, with all kinds of people moving around, and they are orchestrating and coordinate the COVID-19 response, and it all centers around this structure, this infrastructure, this highly technologically developed facility. Now, this is the map of IDH, and you can see, and you are well aware of the plan that we have for IDH. Over here is a modern isolation unit. Over here, we've refurbished all our isolation units. That's in green is where the biobank is. And according to your instruction, we are about to develop a world-class first scan institute for infectious disease research. We're in collaboration with experts across Africa and across the world, because this is a very sophisticated endeavor. And I cannot tell you how many times Mr. Governor has asked me, how far with this institute? You are too slow. Where the designs are ready, sir, you're going to see them next week. So, the other thing we did was we set up the Lagos State Biosecurity Governance Council. This is a governance council made up of very eminent people in the Lagos community. And they bring a spectrum of expertise. They are legal people, they are scientists, they are members of the community, of course the Ministry of Health, and they are the people that are going to be the custodians of Lagos State's biological sovereignty to ensure that Lagos enters the bioeconomy on fair rules and regulations, and nobody can come into Lagos and take advantage of Lagosians, their biological samples or their biological data. And in return, we expect that there will be a dramatic increase in capacity transfer. This group of people are extremely busy because the concept of biopiracy, the concept of biotheft is rife, and it is happening all over Africa, and Lagos State is determined to be in a position to put a stop to it. We are promoting the One Health paradigm. The One Health paradigm says that you are only as healthy as your environment and the food you eat. It is something that's promoted by the WHO. We take it very seriously. It makes a lot of sense. If you live in a place where the air is toxic, the water is bad, the water is full of germs, the food you eat is full of pesticides, it's not hygienic, then you cannot be a well person. Even the stress of a city is part of the contribution to ill health. So we look now at human health holistically, and we talk about the One Health in keeping with the WHO. So, this is what we talk about flattening the curve. The first graph shows you if you do not intervene early, you're going to have that peak, and that peak will go across the dotted lines. And that dotted line is your capacity to withstand a surge of people. If you go above the dotted line, it means you've run out of beds, you've run out of human resources, you've just failed to cope with the outbreak. So it's very important that in our strategy that we keep the curve below the dotted line, which is our capacity to manage the number of people that are getting sick. And I think that is exactly what has happened in Lagos. In fact, we had, at the peak of our outbreak, we had a slight excess in beds and a slight excess in manpower. If it had gotten worse than that, then we may have gone into a bit of a sticky situation. So when we talk about flattening the curve, this is exactly what we're talking about. Now, to prove the point, this is Lagos data. That's the profile of our outbreak. You can see that we peaked in July, August, as we predicted. And these are the cases in the top 5 local governments, and as you can see, it's followed the same plan. This is real data, so we're not telling you stories. This is what happened in Lagos. And just to prove the point, the blue bars represent the amount of testing we're doing, and the red line shows the amount of positivity. And you can see that in August, there was that sudden dip, and we're just hovering at a very low level of positivity. And we're maintaining our testing, if not increasing it, just to make sure that we have nipped COVID in the bud. So, in keeping with our themes agenda, pillar number 2, we work very closely with Ministry of Environment to develop the One Health paradigm. We, by virtue of this meeting, we are in touch with people all over the world, and we're harnessing global minds to help us to build and continue to develop our biosecurity roadmap. And this is exactly what we want to be able to achieve in the future. It's not just early response. There is a point before early response, and that point is called surveillance, so that we have intelligence of what's going on in the community, and we can pick it up even before a potential outbreak is about to establish itself in the community. And then you can see there that you will abort it almost in a matter of 2 to 3 weeks if you are able to have very robust surveillance and pick something up. For example, in Wuhan in China, if they had had early surveillance and picked it up early and contained it, we would not be in this global pandemic situation that we find ourselves. So, as always, and as you keep telling us in cabinet, you have to be able to monitor what you've done, to see where you've made your mistakes and to strengthen your strategy. We in 2021 are going to carry out an independent Lagos State COVID-19 response review. We're going to try and find out what we did well. We're going to find out what we didn't do so well. We're going to learn. We're going to learn from our mistakes, and we're going to use those learning points to strengthen ourselves for the next event. We don't pray for one, but the trend is there. And if we had folded our arms after Ebola, we would have been in a mess. So we're not going to fold our arms. We're just going to get more and more prepared for whatever nature wants to throw at us. Thank you very much for your attention. We now look forward to an interactive session with some
WHO, World Health Organization, sees and how we can move on. And let me start by commending Lagos State government for the way COVID has been handled to date. The government deserves a commendation, and it's coming from a lead partner like World Health Organization. Because we've been involved, we were there right from the ICS meeting preparation before even the first case arrived. So we see what the government of Lagos State, and for that matter, the government of Nigeria has done. The theme for this conference and the timing are very appropriate, especially when we look at the situation the world finds itself now. Why is the organization saying this? Because the whole world is having an increased threat from pathogens and toxins of high consequences due to more factors, but notable among them is our high mobility. The environmental degradation we see almost every day, the climate change, the population growth and spread, and the technological advancement we are seeing. These things put the world, and for that matter, Nigeria and Lagos, in a situation where we need to be prepared always for bio-insecurity. The high human-animal environment interface has direct implication on biosafety and One Health approach. It is in the line of this that WHO continue to support the states, especially as it fulfills its mandate in the International Health Regulation where member states agreed in 2005. The organization also assists in building capacity, and especially in biosafety, laboratory biosecurity, and biocontainment practices. They continue to improve laboratory risk assessment, diagnostic and testing, and also support field coordination. And the organization has been on top of this in Lagos, in Nigeria, and all other countries that COVID was reported. There are strategies strengthening the global health security, the international health regulations, public health laboratory services, minimizing risks of spreading infection, then rapidly detecting and responding to health emergencies, and beyond all, prioritizing diseases for research and development in emergency context, as Commissioner for Health Lagos has already talked about. Now, there are some guided actions that should inform policy. The roadmap we just saw, it's ending in 2020. There should be another roadmap that puts us into our preparation, our actions in the next 5-10 years again. Again, we should increase biosafety awareness as part of our routine services. Improve regulatory bodies' performance to be able to tell what is there and what is not there and what should be put right. Enhance laboratory safety practices, improve bio-risk management, ensure continued training. After COVID, we should not leave it. We should ensure continued training to sharpen the skills and knowledge and practices of our core health emergency responders. Again, create enabling an environment for response. We should be prepared. For COVID, we responded at the same time building, and it's a lesson learned. We should also invest in preparedness and again, surveillance, medical intelligence. And if we can, at least each LGA should have 5 officers to focus on surveillance. In many instances, you hear from the media, strange diseases killing children in this place. As you go into it, it's something that if our surveillance has been sharpened, it could have picked it easily. So we need to strengthen our surveillance at especially the level of the LGAs. And the last point we would like to make is to take note that no disease will remain eradicated or controlled, effectively contained, until member states and every level of capacity participate in essential global health practices. Thank you very much.
Security, what comes to mind is army uniform, shooting, or whatever, but or wars, or the World War pictures. But in the last 20 years, there's an increase in sea level. So you are likely to expect conflict from demographic transition. You are likely to have conflict from a community being displaced. If a community is swallowed up by water, where do they move to? So we shall see a new battle for resources. The same vein, and climate change also is giving birth to some changing forms of biological agents. That is why this topic or this area of biosecurity is very critical. in our national security planning. And to say this at this point that Lagos is providing leadership in biosecurity and biobanking. I think they deserve a round of applause. Now, biosecurity is about life security. It was in the words of McMara that said that security is development because you cannot divorce the two. If a people are not secure, they cannot develop. Whether human development, whether physical development, whichever area of development. And so, biosecurity is just a pillar of that aspect that we need to work on. And I want to say this, because it's not a day of speeches, that biosecurity, there's one area that I need to stress that has not been mentioned since yesterday. I want to say, please, that as much as we are developing human resources, we are developing human capital in biosecurity, evidence has shown globally that the greatest threat, because when you have a very wonderful structure, a very half-layered protocols, the greatest threat you will have to biosecurity will be insider threat. And that is the area that Lagos must begin to do something, because every human being is vulnerable. In the intelligence community, every man has a price. A man that may not price for $1 million may fall for $2 million. So there's a need for us to put in place what I will describe here as human rehabilitation program, that we must start it so that Lagos will get it right ab initio. Human rehabilitation program is a system put in place to bring about vetting of personnel. So it's not enough to have a PhD, it's not enough to have an MSc, to work in the lab, but you must have the character, you must be vetted. If you are given to PIFRIN in secondary school or in the university, you have not placed in biobanking, because when your lifestyle cannot be fed, you are vulnerable to be influenced negatively. So continuous vetting and reinforcement of best practice. I want to say that this is very critical so that we can get it right. On this note, I want to wish us well. I've been here since I'm still learning. I want to say great things are happening in Lagos. Everybody knows that Lagos is not just for show. Lagos means business. Thank you very much, and God bless you.
And response is concerned. Lagos State is an oasis in the desert of our national unpreparedness and lack of response. What we are calling success in Nigeria today is a reflection of our failures of the past. The things we are building should have been built years ago. And so what we are doing in most of our places, we are making our ammunition at the forefront. We are pouring icing on a very rotten cake. I'm a product of an enabling environment that Nigeria created while I was growing up. And that foundation was what I built on, by the grace of God, to become what I am today. I did not go to Harvard, nor did I know the direction where Yale is. But I went from my school, St. Bartholomew's School, Anglican School at Ilu Ayorubo, in the village of Ibu Ayorubo. I went there to Ayedotun Community High School at Ibadan, and I had my university education very close to Sambisa Forest. I began doing all my study in this country, a country, despite its flaws and scars, I will always be proud, a country that I'm eternally indebted to, and a country to which I'm not able to pay what I owe this country. I know my country can create and sustain that same environment, and much better, that was created for me, for the current generation of very smarter people who are much more smarter than I am. I'm appealing to those in a position of authority to possibly affect the life of Nigerians and alter the national drift into decadence. To do so through accountable transparency and implementation of well-funded priority projects that will enhance the quality of life of the citizens of Nigeria. Today, I remember and will never forget the one and only Chief Obafemi Awolowo, who during his tenure as Premier of the Western Region established the free and compulsory primary education, which enabled me, the 47th child of my hugely multigamous father, not only to have an excellent education, but also to have it free at all the stages, primary, secondary, and tertiary level. To our policymakers, we want to remember you for the good you do to your people. As we remember the chief as a hero of Nigeria's development, so also we remember the thieves who misuse positions and who are becoming the heroes of Nigeria's decline. Let me leave you, distinguished policymaker, with a story that I hope will touch your heart and make you a better leader. In 1989, a young American came to Nigeria on a 4-week field training in infectious diseases. During the stay, he watched us as we isolated viruses from field samples at Ibadan. It followed us on a trip to Kanijile. He was with us as we investigated a suspected Lassa fever outbreak in a village near Bida. In 2019, 30 years later, he came back to Nigeria at the invitation of my government as an expert and a consultant to help and teach us, including me, how to investigate Lassa fever outbreak, which I taught him 30 years ago. I was one of the students he came to teach. And you asked me not to be mad with my government and the policymakers who created that environment that turned me a once expert now into a novice. I can only thank you when you do your best for the good of this country, when you implement policies that will turn Nigeria around, not just for good, but for be the best, policies that will create that enabling and conducive environment for the smarter generation of Nigerians of today. We have the human resources, the talented researchers. What separates the Nigerian researchers and scientists from those in diaspora is the enabling and conducive environment to function. We have a carpenter in Nigeria, but they are not giving them the saw to work. We have the mechanic, but he has no spanner. My dear governor, yours will be a tenure of that we remember, as we remember the people like Szabo. And Honorable Commissioner, I know you are doing great things, but let your other governors do the same thing so that Nigeria will move forward. I want to thank you for this opportunity. I'm so delighted that Lagos is doing what it's doing, but we cannot have Lagos alone. You're doing that on others must do. And when you get to your governors forum, please tell them. Let some of us come and talk to them. And let's show our heart to them. Let's eat. Thank you, sir.
From the inception, as you know, from the 27th of February, Lagos State and Ogun State had a collaboration over the first case and subsequent cases as well. And as I said yesterday, a lot of our response was around, coordination, collaboration and communication. And the coordination was led nationally by the NCDC and Federal Ministry of Health, which was supervised by the Presidential Task Force, as we all know. But in a regional aspect, obviously because of your experience with Ebola, I believe Lagos State was in the state of preparedness when the first case actually struck. In our state, we did not have any cases of Ebola, so the case was actually an Ogun State case that was transmitted through Lagos. So we had to respond and prepare at the same time. But we had the expertise and support from Lagos State, having been through Ebola, and I believe we worked collaboratively. We borrowed some scientific evidence to help shape our responses. My governor, Prince Dapo Abiodun, the executive governor of Ogun State, led our response effectively because the first assignment he gave me after the case broke out on the 28th of February was, you must go to Lagos and find out how they got the biosecurity lab. I came to Lagos with a cast on my foot, looking for how I could get a level 3 bio safety lab. But moving forward, the response as we watched Lagos, the Ogun State has 5.8 million citizens, and 1 million of those actually work in Lagos. So it was imperative for us to watch what was going on in Lagos so we could actually, respond to the changes in Lagos to protect our citizens. So Adodota and I think Ifo local government, which bordered Lagos, were our major challenges, the hotspots, not because Lagos was infecting us, but it's just there was no boundary. And eventually we figured that to mount an appropriate response, my relationship with Professor Adeyemo had to become a one-to-one relationship, and I would call him and find out what the next step sometimes has to be. That helped us actually respond. So far, we've done 25,000 tests. We've had 2,700 positive cases, and we are fortunate enough that we've only had 31 deaths in the state that have been recorded. And that can only happen if you have research data coming out. If Lagos had not been pushing that research out, we wouldn't have been able to respond. Other states followed Ogun State and FCT to watch what we were doing because we were not the epicenter and the resources had to be attributed appropriately. And we couldn't appropriate the resources without evidence. So investing in laboratories, also we have the support of Lagos before we could actually acquire our own laboratory about 6 weeks down the line. We had to depend on Lagos laboratory. We had to send our case management team to Lagos for a whole weekend, and there were nights that I was in Lagos till 11 p.m. With some of our cases, because the initial phase, we didn't actually know which way it was going to go, so we literally knew each patient and we followed them up. Lagos has been very gracious to Ogun State, and I know my governor works closely with you as well on the Governors Forum. But what have we learned? What I have learned as a commissioner is we don't need to reinvent the wheel. We can always learn from each other, and I'd like to congratulate you, Professor, that we're holding this meeting because you're actually leading the way, and I'm taking notes because biosecurity is not necessarily priority on one's list on a normal day. But there are things that I'm asking, where do I store my samples? I don't have a biosafety bank, so we need to start formulating, policies around regions. I don't think we should be existing as states. It has to be regions because not every state will be able to actually purchase a state-of-the-art biobank like you have. And I've got 25,000 samples. They might be useful for research in the future. Nigeria as a whole, that's at the sub-national and regional level. There's the national level as well. What do we do with all these samples that we've collected? How do we keep our healthcare workers who are few? How do we keep them actually trained? Because once this epidemic is gone, they'll move on to their routine jobs because we had to bring them out of their routine jobs to make them work in the isolation centers. So how do we actually build a team of infection control doctors that are ready to respond continuously as a nation and as sub-regions? And maybe every state doesn't have to respond. Maybe what we need is a way of actually transferring experts, the institution you're talking about. We need to start thinking about that because Nigeria has limited resources, and that resources, we can't keep, spreading it. If we spread it too thin, then we'll be master of, jack of all trades and master of none. Thank you very much.
I want to acknowledge by protocol. I know the governor Nigerian CDC Director, Dr. Chikwe Igbazu, along with other state commissioners of health and dignitaries present, just want to acknowledge you. So in the short time I have to talk, I want to present updates on vaccine development and share my thoughts as a scientist, a researcher, clinician, targeting an audience of public health experts and policymakers. I believe we all realize the critical role that vaccines have played historically and presently, leading to eradication, near eradication, or mitigation of the impact of various infectious diseases. For the COVID-19 pandemic, I believe that this may really be the only pathway to definitively rid the world of this bio-threat and pandemic. It is heartwarming to see just how much progress has been made with vaccine development in a short period, and this has required innovation at the highest level, collaboration between biopharmaceutical and pharmaceutical industry, academic centers like mine, and researchers, public health authorities, and policymakers and governments. However, I want to make certain observations that are pertinent and relevant to this audience. There is a crowded field for vaccine development, and many candidate vaccines, especially those in early phase clinical trials, may never make it to approval and clinical use in spite of investments in their development. In fact, it is estimated that only about 7% of candidates in preclinical development will be successful as vaccines for clinical use. In some cases, unfortunately, we have seen premature vaccine approvals occur before robust data has been approved and evaluated by regulatory authorities. We know that oversight of vaccine development and regulatory oversight is variable globally. We know that politicization of pandemic responses has colored the public's perception about what should be purely scientific endeavors and has fed distrust of the process. The pace of vaccine research has raised questions about the long-term safety of vaccines being yet unavailable, and also some manufacturing lapses are being identified. Importantly, because enrollment of minority populations in vaccine research in Western settings, reflective of the African community, because that participation has been variable, there is a need to assess the generalizability of research findings in other settings to an African population. Also, and importantly, a lot of work needs to be done to translate vaccine efficacy results into real-world effectiveness, which will depend on vaccine uptake. So on this slide, I'm just showing you a bit of the current vaccine approaches. We know that multiple vaccine approaches for COVID vaccine development are ongoing. Messenger RNA vaccines, never before approved for disease prevention, but that are a relatively safe and rapidly scalable approach, have emerged as the lead candidate with very high efficacy numbers. However, the logistics around the 2-dose requirement and the unique cold chain requirement will hamper distribution, especially in low-resource settings. However, work is being done to address the cold chain requirement through technology. We know that viral vector vaccines are progressing well, but safety events have occurred, although at a very low frequency and with no clear association with vaccine to date. Protein-based vaccines are nearing phase 3 studies, and inactivated and whole virus vaccines are also being evaluated. My thoughts are that because of the urgent need for effective vaccines as quickly as possible, and because manufacturing to meet global demand cannot be met by any one single vaccine manufacturer, all of the vaccine candidates, if successful, are critically needed and will be a great addition to our arsenal to prevent COVID-19. We have learned a lot from clinical trials. We have learned that the efficacy of the vaccines lie not just in their ability to prevent against disease, but that when breakthrough infections occur, they can mitigate the severity of disease. I believe this has huge implications for the pandemic response and how investing in prevention can save a lot of resources downstream, such as avoided healthcare costs and lost productivity from those who fall ill. I will make a strong note, however, that certain populations are not included in most ongoing vaccine trials.
You need to do, the 3 C's, which you trace, you test, and you treat. And they've all talked about even no more than 3 C's now, but there are 4 C's because cash is critical. All of us knew that when we were at the middle of it, communication was critical. Collaboration was very, very important, and coordination. like Dr. Coker said. But behind the scene, Prof did not know that I also have engagement, and I get almost every other day relationship and assessment from other people. The gentleman that came from, that represented WHO, I cannot pronounce his name very well, several times I spoke with him off the radar to be able to give me an independent review, of what exactly we're doing if we're doing several times. I had private meeting with Abdul, that's your EOC, and I needed to ask again, how are we doing? What are we doing wrong? What are we doing well? And several of the teams that were on the front line, that were doing all the very, very difficult jobs, for us at that time, I needed to be sure, and I needed to give that level of confidence that they have a one-line guard, they have a one-line access to me, because for us, and as you've seen, and I've said, leadership is critical, and especially for people that are at the front line, access to that leadership, they need to be convinced that indeed, whatever they require, at the time that in which they require it, it's available. And so there were no red tapes. So part of the things that Lagos State did very early in March was that we knew that we had a cabinet of 42 people. And so I was an incident commander. I said, 42 people cannot be meeting and having discussions. So let's have what we call a war cabinet, because we're indeed going to a war zone. So just about 6, 7 of us, could sit as often as we require to sit, and we'll take those decisions, and those decisions are bound by the entire 42-member cabinet, for us to continue to deal with. And so those are some of the early signs that helped us as a government to stabilize. I think in my attempt to very quickly say a few things, I forgot to acknowledge Professor Tomori. Professor Tomori is someone that I, from a distance, have also very huge respect for. And I want to assure Prof, if he's still online, that the story of 1989 is not lost on me. He had said it, and he had said it in a very, very, very straight and subtle manner. We understand what the issues are, especially for us on this side, us meaning political leadership, at this point in time. It's such a very difficult time to be in position of leadership in almost every part of the world, including the biggest economy, and I'm sure you know why I'm saying that. So it's such a very, very difficult time in which we all need to continue to have our A team at all times, all standing and being counted, doing the right things all of the time. But I cannot agree less with also what Dr. Coker said, that at the point and at the stage in which we are now, we need a lot of collaboration, right? What is working well for Lagos? All in the name of competition, we really don't need to reinvent it, across the border. We actually don't even have any border. We usually say that between ourselves and is New York, New Jersey, they are borderless, because the only other border we have is Atlantic Ocean. So you said it. And so these are some of the things I'm taking back to some of my colleagues. Let's do a lot of collaborative efforts. Where do we store our data? How do we ensure that we keep this data? And I think it's also Dr. Onyema that also mentioned that even while they're doing all of the trials, long-term safety data is so critical. And so if you're going to have long-term safety data, those data needs to be kept somewhere, and they need to be available and be sure that they are secure. So we've heard from the Office of National Security Advisor how well they are taking security, not with bullets and guns and APCs any longer, but with pathogens and with molecular laboratories and all of the things that are not even available to the naked eye. And I want to say that indeed, for you to be here, that means that there are also something that is happening at the national level that we also need to commend them for, and I think they deserve a round of applause. And so, being part of this gathering in the last 2 hours or so confirms part of our own review and part of the things that we say we want to do going forward. We've said to ourselves that COVID-19, yes, is still around us, but it's the learning that we need to have post-COVID-19 that is also very critical. And that's why Professor Olamide actually said that in 2021, we're actually going to dedicate budget to ensure that our learning capability are well documented. What are the things that we did well? What are the things that we did not do well? What are the learnings that we can? So that people that are coming from us could have some documentations and which they can also learn from. That's number one. Number two is also what Professor Tomori also said, that part of our plan certainly should not be to just end at the year 2000 now, because yes, you have a level 3 biosecurity lab, but we need to also have a plan to ensure that we'll continue to scale up and raise the bar, to be sure that in the next 5 to 10 years we have that plan and we're still working, on that plan. And that takes me to part of also the commitment in terms of the leadership that we're also giving to you. Each day I fight with him and say that because you've been so preoccupied with the treatment and all of the learnings of COVID, infrastructure is also important. We need to have boots on the ground. People need to see that we're scaling up, not only training, not only skills development, but real infrastructure on the ground. Even if you don't have money, let's go look for it and ensure that we can build structures that can uplift us. And so that's why I'm happy to also reinform us again that the building for our Africa, we're going to call it African Infectious Disease Center. Because we're not just going to be an epic center for fun. We want to actually also be the research and development center as well for that. And so we're doing a world-class design, to ensure that it meets global standards and will raise the kind of finance that we require. In the same very popular ideas now, we're creating a space there to ensure that we put that infectious disease center, for generations that are even coming behind us. Because like Prof says, he's always scaring us anytime it comes to cabinet and he's showing us all of those slides that you look as if somebody is going to kill us tomorrow. But we take the points. But we take it, yes, I've come to learn, pathogens and these and very communicating something, those very strong words. But I think it's not lost on us that we're in very difficult times. We're in times in which, the wars are not going to be the conventional wars again. There are going to be things that are not even, physical, that are things that we cannot see with our naked eye. And it's only our level of preparedness. It's only our level of preparedness that indeed can save us, from the future things that we don't even know anything about. And so it's really just to thank all of you. It's to commend the initiative behind, agreeing that we have this African conference. I know there's a whole lot of people online that are virtual, that are watching, that are listening, that has participated in this conference. And I want to say that for us as a state government, we're committed. We're committed not just, because Lagos is home to all of us, but we're committed because indeed we want to leave this space a whole lot better than what it is. We're ensuring that the skills that are required from all our frontline health workers are scaled up. What they require to ensure that they keep all of us safe and well, that is provided for them. And the ambience and the environment in which they do that, it's something that they'll be proud of. And we'll have all of the Professor Yema, we'd like him to be ill, but at some point in time, he also can come and participate, in our own local lab, in Africa and in Nigeria. And like what Professor, thank you. And like what Professor Tomori said, that somebody that he once had as a student, 30 years down the line, came back to also be teaching me, on new things, on new discoveries that we have lost. And I think really, as a roundup, is for us as a position of leadership to ensure that there is nothing we do if we haven't deal with education and health as a front line, on all of our deliverables, we have not succeeded well. And I want to make this commitment, very humble commitment here today, that for us in Lagos State, even on all the budgets that we found, this year, for example, whilst we reduce all of our budgets because of COVID issue, we make sure that we increase the budget for health, and we make sure that we do not cut the budget for education. And so it will continue to also reflect in our team's agenda. Education is not for today, it's for tomorrow, and it's for the generations that are coming behind us. Health, like they keep saying, you can never be over-prepared, but like, you plan for the worst, you hope for the best, and so that's why we must ensure that our health is also very critical, because it's only when you have an healthy citizen that you can actually have a wealthy citizen. And so on that note, I want to congratulate all of the participants. I want to commend you all for coming, and I'm hoping that the rest of the evening and tomorrow will still be as engaging as it's been since yesterday. Thank you very much. Enjoy the video.
Please let's give her a round of applause. Are we tired? I think we've just taken our lunch. I think we should have some energy here.
Food, what to eat, sustenance, and even around resources in the home often cause flashpoints. We also noticed that when we did a polling of the incidences of gender-based violence across an 8-month period, including April, in April, incidences more than doubled. So where we were having an average of 17 cases between January and March, in the month of April, we had a total of 35 cases. And those were the ones that were able to use our online services, our toll-free lines to call in, and to send us emails. And quite a number of other people could not do the same. Now, what do these things portend for us in terms of a pandemic such as COVID if it comes again? Well, we have a number of recommendations. First is the fact that in addition to efforts to control the pandemic itself, processes, services around sustaining access to counseling and even referral pathways for rights-based issues, access to justice, also must be sustained. Secondly, it is important that we learn how to look at using social media, virtual systems to be able to sustain access to justice, not just for access to health, as being in the context of COVID-19, but also for justice during such pandemics. Then finally, we also recommend that in future pandemics, it's important to look at how communities can build up their own capacities to respond to and deal with issues around gender-based violence. Now, these were the recommendations that we put out, and using this platform from the research that was gathered, we did a number of advocacy. We shared this information not just with individuals, but also with other organizations, CSOs that are working around the issue of sexual and gender-based violence, and even with our partners within this period. And some of these things resulted in concrete actions, such as, for example, setting up a technical working committee in 3 local government areas, which were aimed at looking at how to sustain response, even if there's a shutdown in the system. These committees comprised line ministries and the police, as well as community respondents. So that's the short abridged version I would like to give for this presentation. Thank you very much.
I think he deserves better. Can't we give him a round of applause? Yeah, thank you very much, Mr. James, for giving us that important information and the research you have carried out on gender-based violence. We heard that gender-based violence doubled, especially during the lockdown, and this is something we need to really look into going forward in addressing COVID and so many other issues in Lagos State. But I would also want to let us know here that when the COVID started in Lagos, we have a coalition of civil society called the Lagos State Coalition Against COVID. And all those who are speaking on this panel, they are part of this coalition. And we carried out a lot of awareness at the community level. Not only awareness, we also carried out other surveys. We had a community perception survey. We also carried out a air quality assessment by Nigeria Environmental Study Group.
They're back in school now, but right now in Lagos State, because we work with basic education, that's primary and secondary schools, that's public primary and secondary school. We find out that not all of them go to school every day. You have those that come in Mondays, Wednesdays, Thursdays and like that. And right now, the homegrown feeding is actually supposed to have continued, but as at this week, they're still waiting for funds to be released to school, to the vendors for them to do that. So we don't know if the children are going to have the food this term, or we have to wait till next term. Then another thing or recommendation that we would like to, to give to government is that, the health of these children, they are very key. So, and we've noticed that in schools, we don't think all the schools have a health department. So there should be a health department in every public primary and secondary schools. And also we want them to look into the cases of overcrowded classrooms. We have that here, that, because of, we don't want the outbreak. Like, I think a few weeks ago, we heard that a school, but we don't particularly know that school, that they had the issue of COVID, outbreak in the school. So, and we're not praying for this to happen in our public primary schools. So we need government to build more schools or more classrooms so that we can have fewer children in the classes. And also, there needs to be consistent education on response and cleanliness in schools, in the school environment. And wash facilities are very key, because the environment, the school environment is also key to the health of the children. And also security. We want there to be adequate security for our children in school. So in a nutshell, during the lockdown, it wasn't very interesting, but we're happy that schools, are open and the children are back in school. So we want government to put all measures in place, make sure that what happened during the COVID-19 will not occur or will not meet anyone, suddenly, thank you.
We are not ready to clap. Please, can we give him a better round of applause, please? Thank you very much, Ronke, for that short and precise presentation. And so we go to Olamide. Olamide, who is the Executive Director of International Climate Change Development Initiative, and he's going to be talking around Women's Health Support Program during COVID-19 in Lagos State. I suppose that's one of the activities carried out by your organization. So?
Okay, so basically, during the COVID-19, my organization and some couple of volunteers, we actually noticed that one of our efforts that we have been working towards was working in a community called Shomolu and Bariga. And because of this, we decided to go to that community to actually see what are the needs and what are they actually facing, and how we can also contribute a little bit of what we can to the community. So fortunately for us, we're able to get engaged with the Lagos State Civil Society network on COVID-19, which actually helped us to create more support for the community. So the program we had then was, we started with what we call Max Up Community, where we noticed that from what the NCDC has been talking about, issue of face masks, issue of hand washing and stuff like that. So we decided to have a conversation around that to create what we call community engagement using different stakeholders and different working groups. So we did this with majorly the women and children. And so as time goes on, we get a little support from the Lagos Civil Society to also carry out another awareness and advocacy at Etiosa, where we met with the chairman of the community and some other leaders there as well. So coming back to one of our ongoing program now, because we noticed that although the COVID-19 issue has started, getting it, but we noticed that we just need to keep taking precautions. So we started a program called Women Health Support, where we want to provide health support program for women in the community. So we are going to be focusing on 3 communities we've already started by doing a little bit of research on what are the needs they will be looking into. So one of the research we are doing is to actually identify the kind of health issues they are having that's related to the COVID issues. So we are going to be providing some, like an insurance support for the next 3 to 6 months for those women in the community, to now see whether they actually also respond to the issue of health issue in the community. So we are doing this to make sure that as part of the contribution and to support the effort of the government in making sure that this issue of COVID-19 goes down a little bit. So that's why we are doing this. And with the support of other funding partners, international funding partners, we're also trying to make sure that we provide more water and do some water sanitation and hygiene program as well. So with this, we just want to keep saying that government should continue their effort in making sure that our community is conducive for everybody and the environment is also sustainable for every individual and other stakeholders. Thank you very much.
Because during COVID-19, a lot of people believe that you could just take any concussion, it will take care of, maybe prevent, infection. We also look at the level of vulnerability, to COVID-19 at the community level. Looking at those things that are likely going to trigger, infection. Also, we look at the kind of support people in the community are likely going to give to those who are already infected. Looking at, level of stigmatization. So we also look at what is the perception concerning community treatment. At a particular point, Lagos was considering, treatment at the level of the community. We also wanted to find out from them what they really think about this. Then, but likely, one issue that came out from this survey is that Lagos residents were yearning for more information, awareness, keep coming up. People wanted information from Lagos State government, even though they also agreed that the Lagos State government has done virtually better than other states in Nigeria. People still felt that when it has to do with constant information, they didn't see the local government as active as they would have expected. People felt that local government didn't play a more significant role. And when we also posed the question that between the Ministry of Health in Lagos State and local government, they are working in hand, but people believe that those at the level of the local government should be able to at least provide the kind of information to them. And we asked them again, what are the mode of passing that information around. People felt that local government should have a way, maybe going around by, with buses to also appeal to people, to tell people some of these things directly, since they were elected, by the same people. People felt that members of the House of Assembly could also lend their voices to giving out information. So we felt that at a particular point in time, and this is also part of the recommendation we are giving out, that came out from this survey. There's no amount of effort that will be carried out by Lagos State government and even the Ministry of Health. People at the level of the community need to key into some of those efforts. So we are recommending that at the level of the Community Development Council, the CDC at the level of the community.
Bio, which means biology, and security, which means safety. So biosecurity has to do with safety of biological materials of human beings, animals, and plants, and their environment. And pandemics is caused by infectious disease, which is a biosecurity issue. So by the time you're linking biosecurity with pandemics, we are seeing all we can do to reduce the impact or the effects of pandemics in the world. So biosecurity is encompassing, not just for human beings, but for plants, animals, and our shared environment. It can be an environmental issue. In fact, it's an environmental issue, but separating waste can be positively used if it's well separated, and if you maximize or separate those waste in such a way that you can recycle it and use it for other means. So waste should not be waste that things you throw away, but there are things you can effectively reuse, repackage, and you can use to generate even income for people living in Lagos. Interact in a language that both of them understand so that they can interact effectively with each other and can be able to transfer scientific findings to policy decisions that will influence policies in the country, region, and in sub-Saharan Africa.
These kinds of COVID-19 events. So if it's not COVID-19, it could be Lassa fever, it could be flu, it could be cholera, it could be Ebola again, it could be anything, any of the hemorrhagic fevers. It seems like we're seeing more and more events happening at shorter and shorter periods of time. And there are many factors that are contributing to that. Expansion of human population, the abnormal environment, the way we are managing our environment is very abnormal, climate change, then the mobility of people. You know, you can get into an aeroplane and you can be anywhere in the world in 8 hours. You know, you could be on one side of the planet and in 8 hours you're somewhere else. So all those factors, as well as the biotechnological advances. So people are able to change these germs from their natural state into something even more dangerous. You know, it's part of science. They do this for reasons. They do it for reasons. It's not that they're trying to create things that are going to cause harm. But, you know, scientists are always looking for what the pathogen is going to change into so that they can understand it before it changes, you know. So there are all these things happening around the world, and we're beginning to see these escape of dangerous pathogens from the environment, from animals into human populations. And then once they get into the human population, if we don't detect it early enough, it starts to spread. And once it has left a region, it's gone on a flight or it's gone on a ship, then the whole world is in trouble. So this is what we're experiencing with COVID-19. It started somewhere and now it's everywhere. You know, thousands of people are being diagnosed every day, millions of people have died, and it's not over. You know, so this is the 6th African Biosecurity Conference. Every year we have one since Ebola. And we move around so that we are able to enlighten governments, countries, that this is a serious problem. It can even start in Africa. It can come to Africa. You know, anything can happen. And if we are not aware, I mean, the whole world is in an economic crisis now, coupled with security issues, all because one virus came from the animal kingdom into the human population and has caused a global shutdown. That is how serious this situation is. So we come together at these meetings to understand what is happening, to understand what we need to do as a state, as a country, and as a continent, and what we need to do to contribute to the global attempt to push back this phenomenon. Now, COVID-19 is a phenomenon. Yes, it's a virus, but why is the virus spreading so fast? And what are we doing as human beings that are causing this thing to happen so frequently? We need to go back to those issues. It's not just about treating COVID-19. It's about addressing the issues that are causing the problem that allow viruses like COVID-19 to jump and cause such havoc in human populations. So, you know, as a region, as West Africa, we've been able to influence the West African region that, look, you know, mega cities all over West Africa, we need to be careful. You know, if a dangerous pathogen gets into any of our mega cities, it's going to create a regional crisis. We saw that happen in Ebola, so we already have that experience. Now we saw it happen with COVID. We saw what can happen. So we are saying that as a region, as a country, and as a state or a subnational, we must have a harmonized approach. There's no point Lagos doing something, or Senegal doing something, or Ghana doing something. We must operate as a region and as a continent, right? Because these kinds of resources that you need to fight these pandemics, the resources are huge. And there's no need for every state to have or duplicate these kinds of resources. So Nigeria needs its own strategy. West Africa needs its own strategy. We need to align. We need to save costs because a lot of work needs to be done. All this infrastructure that you have seen so many times, many of you have seen it at Yaba, it costs millions and millions of dollars to build, to man, to maintain, and to expand. So it's not you know, it's not like we don't have other priorities to deal with. We still have education, we have energy, we have roads, we have infrastructure, we have all waste management, we have all kinds of priorities in Lagos State. So we have to share our budget, and we have to cooperate, collaborate, work with our international partners. They too have resource constraints, so it's not as if anybody has an excess of money. So it's a means of everybody coming together. There's no need to reinvent the wheel. Let's learn from each other, let's share resources, let's share experiences, and let's make sure that more importantly, we address the forces that are driving this kind of phenomenon. What we're doing now is we're trying to put out the fire. COVID is a fire, but who put the fire together? Who put the wood and who lit the match? Those are the things that cause COVID-19-like phenomenons. Is environmental destruction, is unplanned expansion of cities, is lack of proper sewage, lack of access to water, lack of hospitals, movement of people, the way we treat our animals, the way we just go into the forest and kill animals and eat them. You know, these animals have dangerous pathogens in them, you know, and, you know, in developed and regulated environment, not anybody can go and kill any animal anytime you feel like it. There are only people, certain people that are allowed to do that, you know. So these are the kinds, these dangerous pathogens, like Ebola, they live in those animals. If you go and handle that animal without due care,